Local medical community will take a huge leap in the right direction. The UT RGB Smart Hospital will open its doors for the first time to the public for an unveiling and dedication. It's bringing leaders in medicine and academia to the Valley today. Dr. Joseph McCormick, Vice President of South Texas Programs at UT, is here to explain who will utilize it and how it will benefit their education. Thanks so much for being here with us this morning.
My pleasure. Thank you very much.
So why don't you go ahead and tell us a little bit more about the Smart Hospital, how it got started, and how it got funded.
Well, it was funded through the University of Texas system, and it's a great asset to the new university. Over the last 2 decades, the health professions have taken advantage of computer technology, and they've created these mannequins that look like the mannequins you would see in a store, except they're far more sophisticated, and they can actually respond to all sorts of medical conditions just like a human can. And this provides an opportunity for students at all levels, even high school students, to take advantage of this and learn learn medical skills even before they actually see real patients.
So there's going to be doctors that are going to be able to go in there and actually help educate future doctors and even the high school students that are looking into the medical profession. But it's not just going to be doctors, it's going to be all levels of medical care. Exactly.
And in fact, the network that we've created with the Smart Hospital includes EMS, the fire and police. It includes all of the institutions such as South Texas College, TSTC, UTB, UT Pan American. All of those institutions train health professionals, nurses, physician's assistants, laboratory technicians, medical assistants, and of course the new medical school will train physicians. So all of those students will take advantage of this particular facility, which is located in Harlingen. But the good news is, using information technology, computer technology, we can share that information across the internet with all of our partners in the whole region. So we can actually broadcast what we call scenarios. These are situations that we create to train students how to respond to them in the hospital or clinic setting. And we can broadcast those across the entire region simultaneously to several different locations, including our hospitals. So it provides an opportunity for a really broad education of many different kinds of health professional students.
This is a very advanced state-of-the-art facility that costs $10 million to build. So how can students in the Valley take advantage of this particular facility if they want to? Is it going to be through internships? I know that a lot of schools maybe have magnet schools where they can do rotations there. How are they going to get to do that?
So there will be students who will be doing rotations from the high schools, for example. We have 3 health profession high schools, 2 in South Texas ISD, and a new one that's being constructed in Harlingen. And so all of those students will have the opportunity to take advantage of this, and other high schools could do the same thing, and even middle schools. We now have some middle school students who are going to be going through the facility, and we can gauge the level of students, whether middle or high school or other, and provide different levels of scenarios to start to teach them. Imagine the advantage of a kid in middle school who gets a chance to be able to do this sort of thing. So this is a tremendous asset to all of our kids, and we really believe that this will help to promote the health professions and provide opportunities for children really early on in their education to get excited about health professions.
Absolutely. They're going to get to learn early, but they're also going to get the opportunity to figure out if this is what they really want to do. We want to thank you so much for being here with us this morning. We're going to keep you around for our next hour and talk to you again about this and go into a little bit more depth into this conversation. In the meantime, let's go ahead and head over to Mary.